situation. So we're really excited for her to be in.
Available all throughout the county. Um, if this continues to be a positive partnership. Yes, more.
I, are, is BN Outreach one of your fire? Yes.
at Saddleback Church in Lake Forest. So a little bit of a, arguably a little bit more of a remote location. Saddleback was a fantastic partner, and I'll go through some of the highlights of the day. But even with the sort of, for lack of a better word, slightly more remote location, we saw a tremendous amount of participation from individuals that needed assistance. And then we had such a large group of vendors that came both from work that they're doing with the county as well as work that's being done with the city. Let's see. So as they move on, so as we get to the next slide, it'll pop up in a minute. We just wanted to highlight the roughly 25 different vendors we had at the event on the 24th. It was, as I mentioned, groups from Child Supportive Services, Coordinated Entry, our healthcare agency, the Social Service Agency, the Clerk Recorder, Probation. So from all of the different county departments that showed up, we had great participation from them, but they were really a minority of the groups that were there. As you could see here, we had a whole host of nonprofits doing this work that were there. Good example is Chrysalis, that, as we know, does some great work around employment, Families Forward, Friendship Shelter, South County Outreach, who is such a great partner that provided a mini sort of food pantry at the event. Revival Hair, this is a group that has been at both of our events. They provide haircuts to individuals. They were booked solid again for the second straight event, which was really exciting. And then on the bottom right hand, we had Loving Paws, which was a really nice new vendor at the event. And my original thought was that they were going to be providing a whole host of pet supplies to help folks. But then, as you can see on the picture on the top or the bottom left-hand side, they had like a grooming table, and all of a sudden, I turn around and they're grooming dogs. And this is a group very much like Revival Hair and the rest of the providers there, but Loving Paws and Revival Hair are two really small nonprofits that are run by essentially one or two people. That this is not their main line of work, but this is their passion, and they show up, to our events, and it's really not only inspiring to see people get help, but it's inspiring to see who's providing that help. We're excited that we have our third Same-Day Solutions Fair lined up for September 25th, I believe. Yep, September 25th in the city of Orange at the Hub, the drop-in center in Orange, which is right down the street from the Family Care Center. We think that this is going to be our most heavily attended event. So we're really excited about that. We have Placentia in partnership with his OC, an event scheduled for November 20th. And then we're working with several other cities to essentially host events basically every other month. And we're hopefully we're penciled out, not permanent yet, but we're penciled out till this time next year. So, it's just turned into a really positive event. Let's see. Lastly, just a few stats. So, entering the event, knowing the location, we're in South County. We're also, like I said, off of the toll road, a little bit more of a removed event. For me, I was like, if we could get 80 to 90 folks to the event, I'd be really excited about that. What we saw was 120 unduplicated households participate in the event. We saw, unlike different from what we saw in Santa Ana, we saw a lot of families engage in this event. Parents with children come and access services, and it just reminds at least myself of the many different faces of who is experiencing homelessness and who we as a big system support. So as you can see there, 585 service engagements, essentially 2/3 of the group received services from our social service agency. Um, uh, 35% received services from our homeless collaborative court, which has always been an anchor. So, always thank you to the DA and the DA's office for being such a great partner here. And then 50% of folks received services from our clerk recorder, who was on site with their mobile event as well. So, yet again, I could go around the room, and I probably should, but almost every single commissioner here has participated in at least one of these, and we couldn't make it a successful event if we didn't have the leadership around this table. So I wanted to thank everyone for that, and I look forward to seeing you all in Orange, and then in Placentia, and then the rest of our cities. So with that, I'll pass it back to the chair.
Yes, thank you, Doug. Yes, Commissioner Parks.
Yeah, thanks for the update. It's exciting to hear how well these been doing these last two. I'm just curious if you've had a chance yet to cross-reference the names with HMIS. How many are new?
So we've tracked all of them and entered them into HMIS. We've done satisfaction surveys at both events, and those satisfaction surveys included both hearing from the participant and the vendors, and we've really seen great feedback. And as I mentioned after our first one, the tone that keeps being struck is that especially really both the vendors and the participants talk about the atmosphere that's set there, that they get a sense, like they do often, but especially at this event, that the vendors there are really interested in helping folks, and it just feels like a day of progress and success. But yeah, we're in, it is on our to-do list because we really want, and we've committed to tracking long-term progress here. Are the folks getting housed? I believe one of the stats that's not here, there was about a half a dozen placements into our shelters. Now, it's a South County event, but everyone across the county was welcomed, and we were appropriately able to verify, whether they belonged, if they were connected to the spa which the shelter was in. But yeah, at the end of the day, we want people to get housed. That's the only thing that's going to end this journey. Lastly, I'll say there's two things that it reminds me of, and I think it's important to say every time. One, which is the event is only unique in the sense that it brings all of these vendors together. And I say that because each one of these vendors do this work day in and day out, and their impact is every day. And I think it's important to recognize that this isn't just one day every 2 months that our system shows up to help. Just so happens that on these days we get together. And then the second piece that's incredibly important, and I think it will lead to some of our conversations later, is that it continues to demonstrate that people experiencing homelessness on an overwhelming percentage scale are interested in improving their situation and ending their homelessness. So yeah, it's such a great event. So thank you, everyone.
Thank you, Doug. At this time, I'd like to open it up to any other commissioners for comment and discussion. Since I forgot to do that on item 1, feel free to comment on that one as well. Yes, Commissioner Rose.
Yes, I just want to echo some of what Doug said. It was such a positive experience seeing all of the nonprofits together and really seeing people get the help that they were looking for. And yes, it was a remote location, but I think that worked in our favor because it was a shaded area. No one was walking by, cars weren't driving by, there was a sense of privacy, I think. And I think that really helped. It helped some people let their guard down a little and start to accept the help that was offered. So I can't speak highly enough of this event. I'll definitely be reaching out to other city managers to step up and really try to engage and host one of these because we had such a positive experience.
Thank you, Commissioner. I know that my team really enjoyed being out there, the team from Homemade, and we provided care kits for people that came to find services. And I love that we're doing this in lots of different locations around the county because we need to meet people where they're at and be able to provide them with everything that we're able to give to people experiencing homelessness. So thank you. Okay, thank you, everyone. Madam Clerk, will you please, Commissioner Penniman, thank you.
Hi, thank you. Just a couple of comments. One, I just wanted to speak to the staffing updates for OC outreach and engagement. I haven't worked with Kevin Alexander, the new outreach and engagement manager, but I have worked a lot with Karen Batances, the new director of programs, and I'm really thrilled to see this. She's a very highly respected member of the Orange County team, and I think anyone else on the provider or operator side would agree with that. I think the work is extremely challenging, and you have high quality staff who protect the mission, right? Which is about budget, fiduciary responsibility, optics. But it's one job to make sure that the County of Orange is fulfilling its obligations and requirements. It's another thing to have the resources put out effectively where the people in the field feel supported and coached is the word I would use. I've had many long calls with Karen and her team and how they approach the work that they do, and it's always about capacity building. So I just want to say these are really great changes. I'm just really thrilled to see that the county is supporting the retention of these high quality people during these types of times as well. And I have one other item as well, which is going back to the grand jury report. I noticed that some of the comments did relate to the commission. So I'm wondering, as the county creates its draft comments, would that be something that the commissioners would be asked to give input on? See in draft form, you have 2 days for comments or to provide input. But I would just note, since there's so much tied to that, and I thought I'd put that out there as an open-ended thought.
Thank you, Commissioner Penniman.
So when it comes to the grand jury, we traditionally, as a staff, work to help draft the responses, which is the process that we're doing now through the CEO's office. And then the item, the draft will go to the board at a specific board date for formal approval. That is really where there would be a space for commissioners if they're interested in providing a voice to the response. I'll also remind folks that agendas to the commission, to the board meetings are posted 2 weeks prior to each meeting. The materials are there as well. So.
Thank you, Doug. Yes.
I know our office would be happy to get your comments or anybody else's comments.
Thank you. Is there any other comments or discussion? Seeing none, I'll ask the clerk to read the next item.
Thank you. Item 3 is the Commissioner Spotlight with a presentation by Susan Parks, President and Chief Executive Officer of Orange County United Way, and serves as the philanthropic leader on the commission. And we have no requests from the public to speak on this item.
Thank you, Madam Clerk.
The opportunity. So I'm Sue Parks, CEO of Orange County United Way. Probably many, can you hear?
Can you push the button? Is it the red button? There we go. Thank you.
Should I start over? It was so riveting so far. I'm Sue Parks, United Way. Many of you know the brand, the United Way. We've been around here in Orange County for over 100 years. It's our 101st year. Every United Way is a separate 501c3. So I just also want to say everything we do at Orange County United Way is to improve lives of people who live here in Orange County. We are fortunate that there are other United Ways around the country, and so we can collaborate, share best practices, and learn from each other on what's working, what's not. So that's a wonderful network to have. But again, everything we do is about improving lives here. So I report to a local board. So more to come here. So we are focused on helping lift people who are low income, living in poverty, whatever your chosen phrase is in terms of people that are struggling to get by. I will say one of the things that I think we all should be aware of here in Orange County is it is a hard place to live. It is expensive to live. It is a fabulous place to live. But we do a research every year on what's called the real cost measure. And for a family of 4 here in Orange County to live without assistance It's about $127,000 household income. And so I just want to put that in perspective. So when I start talking about the work that we do in homelessness, keep in mind that many people are working, but if one paycheck gets out, they lose one paycheck, they start down a slippery slope. So it's something that every person in Orange County needs to care about, and it's a pleasure to be with all of you who care so much. So again, our vision is an Orange County united, remember that word, to improve lives today and for generations to come, that we're all in it together to help people in Orange County. How we work, we do it by really mainly three ways: collaborations that we lead and bringing people together to solve big complex issues or be a part of. We work very closely in terms of things we do on advocacy, and then strategic programming. We're big believers in transparency and measurable results. So there are four big areas that we are focused when we do this work. And so this came out of a lot of focus groups and research and community outreach and things over the years about what are the biggest things that people are concerned with. And the first one has to do with United for Student Success. And that's our programming, our efforts, our initiative all around helping primarily first-generation students, but students who come from low-income households graduate high school with a focus on how are they going to be successful here in Orange County, right? So we do a lot of things to inspire them. We match them up with e-mentors. We bring classroom speakers from businesses they didn't know existed. We do them on field trips. We have internships with companies all around the county. All this thing to excite students. That body of work last year, we worked with about 3,000 students. So just a perspective. And we know that if we get them excited and graduated, of them falling into homelessness is going to be so slim. Our next body of work is around financial security, and this is our prevention work. I'll give you one example of the work in this area. I don't know why, but I'm going to get some water. I'm coming up with a red eye, basically. So we have a body of work around financial security. So one of the programs in this area, we lead the free tax prep program for the county. And so last year we helped 14,000 households and brought back about $28 million to those households and to the community that are invested back. People who saved on their preparation fees, people who got their refunds, people who got a tax credit they didn't know was coming. So a huge countywide effort that we lead. I'll talk about homelessness here, and then a couple years ago, many of you know we brought in 211. Why are you guys making me nervous? It's crazy. I'm never nervous. You've heard me speak a million times. Yeah, I know. All right.
You, Susan.
Oh, you guys are great. Yeah, it's weird. Anyway, so what I really wanted to talk to you about today is about vouchers and the idea that you've heard, and Julia and others come up here before, and we learned about vouchers. So how we started our work in homelessness, we commissioned UCI along with Jamboree Housing to do a study called the cost study around homelessness. And that cost study was really pivotal in terms of the work we did and how so many other communities have addressed homelessness. And we learned that in that study, which went back about 10 years now, that if we ended homelessness for everybody in Orange County, we would save about $40 million as a community. And that came from a variety of different sources. I'm not going to cite it. But at the end of the day, the study also showed why people fall into homelessness. And primarily it was economic here in Orange County. I can't speak around the country, but here in Orange County, as I said earlier, it's a difficult place to live if you don't have that consistent, solid income. So anyway, so we had that as our backdrop. And one of the things that we learned is how do you bring businesses? Businesses should be involved in the table. Everybody should be involved in this. So we did a couple things. One, we created a Homelessness 101 class, and we've trained thousands of people around the country to help them change their minds about homelessness and what's going on. We led an advocacy effort to train housing champions. So we have positive voices going out every time a project goes to a city council or planning meeting, that we have positive voices there. And then we started some strategic programming. Well, one of those was around creating a vibrant landlord incentive program. And we did that through something called Welcome Home OC. And do that, we need vouchers. And that's why vouchers is such an important part, in our opinion, about the success of ending homelessness. Our work alone, this is how many have been allocated overall in the county, but through our efforts, we've ended homelessness for over 1,200 people because of vouchers here in Orange County since we started that. So that's just one organization. There are many out there. So Welcome Home OC is our effort. We can work with any service provider and be the person who funds the housing. This is so funny. Whatever it takes is an amazing program that we started with CalOptima, and it's helped over 4,000 people, I believe. And what we do is we work with about 49 different service providers at CalOptima, are part of the CalOptima system. And we help them with, if they run into a situation where somebody has maybe an outstanding dental bill, something standing in their way that's holding them back from that landlord signing a lease, we're able to take care of that. So that's been a fabulous addition. But again, most of those people have vouchers. And then again, we advocate for people with vouchers. All that being said, maybe this is why I'm freaking out, because we all should be freaking out. Because if vouchers go away and they're not funded here, it's a crisis for all of us. So I'm just going to say that during COVID, I think it was 1,035 vouchers came into Orange County for emergency housing. Most of those people had a disability, or they were elderly, or they had children. There was something that was standing in their way. These vouchers ended their homelessness. That funding is going away. So you all should be just like me, a nervous wreck, I guess. Though that we should all be really concerned about this, because if that funding goes away, the housing authorities have to make the decision of not funding new folks that are coming into the system to keep these existing folks housed. And why would we want to disrupt 1,000 lives? They're getting on with their lives. But again, that's stopping the progression of something that works. So my big message to all of you today is we can advocate together. We should do everything in our power before budgets are finalized to keep the funding for vouchers going. Because as you can see, it's ending in the status. The emergency housing vouchers, those 1,053, the funding was, I think, supposed to originally think it would last till 35 and then 29, and they're going to say it's running out in late 26. That's not much time to figure out a solution. The mainstream vouchers, this is a big one for housing people with disabilities. No new voucher allocations. Anyway, I think this is a huge opportunity for us to band together and do something as a commission, and we'd love to be part of this with you. There are some good bright spots. We think the veterans vouchers are going to continue. The former foster youth ones that we work really hard on are going to continue. I just can't say enough about the importance of vouchers, my thing. But I just had one story of a gentleman that was housed during the pandemic with an emergency housing vouchers. He had an infection. He was in the hospital for 4 months. He got out. His family couldn't take care of him. Illumination Foundation stepped in and helped, but he still needed to get housing. They brought us in. We found the housing for him through an emergency housing voucher, and he's getting on with his life. He was living in a shelter after 4 months in a hospital until that voucher happened. We can't let folks like that fall into homelessness again. So all that being said, I'd love for you to remember the vouchers. And then I have something fun for all of you. So the next slide is that we have a campaign. It's called The Person in Front of You. So we'd love you all to be part of this. And it is a campaign to get more people talking about what it means to end homelessness here in Orange County. Again, keep in mind, all we can talk about is Orange County. And so we asked 50 nonprofits what they like in the terms of a messaging together. And it was a profound message, an invitation to speak to one person. Could we change the mind of one person and have that person be a better advocate for all of us? And that message is an opportunity for us to say that it's important for there to be safe and accessible, affordable housing for everyone. So this is what the nonprofit community requested: covert and overt messaging, a public endorsement of solidarity, that we convert passive awareness into active engagement, get more people to say, yes, we need more housing, we need more opportunities for people to be successful here. That's something that's good for all of us. That it's something that creates a lasting visual impact. So this is all coming from the nonprofit partners. And so the answer was, so what? What could we do that works on this? So here's the answer. Here's what the group decided. The what? A two-part campaign. The person in front of you. So just picture, if you will, we're all wearing a t-shirt the next meeting in October, November, and on the back it talks about a movement. And the movement is the person in front of you. I don't know, have you seen these t-shirts where it's saying that the person in front of you wants this of you? So the person in front of you feels you deserve a safe and affordable place to call home. So something that's provocative, that somebody might ask you about it. And we want everybody in Orange County to be wearing these. And so the people have this visual aspect of people care in this community, and everybody deserves a safe and affordable place to call home. And then on November 15th, we're going to do a very cool aerial shot. It's going to be at the Great Park in the soccer field, where we're all going to come together. Hopefully all of you, your friends, your family, all come together with a visual, an aerial visual of a home. Because the only thing that ends homelessness is a home. And we need to grab people's attention. It can't just be all of us around the table. It can't be all the folks that are just doing this for a living. Every single person in Orange County should care that their neighbor has a place to call home. So I'd love for you to be part of it. So I will close now in this very wacky presentation I did. Join us in advocating for more vouchers. And I'd love for everybody to be together on that and to be a part of the campaign. So if you'd like to learn more, contact Bex. I can help. I'd be happy to help you. But again, this is an opportunity for us to come together, I think, in a big, bold way. So thank you.
Thank you, Commissioner Parks. We'll just call it the Wacky Presentation Day because the Vice Chair is chairing today, so that's fine. I can tell you that I do appreciate the advocacy efforts through the United Way. I can remember when we were putting our project up in the city of Santa Ana, FX Residences, that is a permanent supportive housing project. All of a sudden, on The Voice in the Sky, because they weren't in the room, there was someone from the United Way showing their support for that project. So it's critical that we do more of that. I know Homemade being part of the home building industry, there is a movement to try to get to every city council meeting to try to get housing projects approved, because we're never going to make any foot forward if we don't get that done. So at this time, I'd like to open it up for any questions or comments from the commissioners that you might have for Commissioner Parks at this time.
I just want to say,
Yes.
this morning I had a meeting with your 211 team, and they were wonderful, and we're looking at some collaborations with our hate crimes grant. So kudos to you for those being a receptive and responsive team.
Oh, thank you. I loved hearing that. Yeah, we love to partner with you on that. So thank you.
Yes, Commissioner Bruno Nelson.
I just want to comment and say what a pleasure it is to work with United Way and with Sue specifically on the Whatever It Takes program. That wasn't something that was in a book that we read someplace and just said, could you operationalize this? This was something that took a tremendous amount of creativity, a lot of tenacity, and really a lot of reflection on what works and doesn't work. And it's been an absolute pleasure building that program with you.
Thank you, Commissioner. Yes, Commissioner Hurst.
I just want to join the chorus and thank Commissioner Parks for her leadership in the community, United Way's leadership in the homeless space. There may be no better community galvanizer than you and your team. Thank you so much. You've raised the profile of homelessness for the entire Orange County community. As has already been said, you and your team are a joy to work with. You're a tremendous resource for the Orange County community, and the Salvation Army just joins community-wide in extending our thanks for your tireless efforts and inspiration, even with this presentation today. Always innovating, always pushing. Thank you so much. We really appreciate it.
Thank you so much. Thank you so much, Commissioner Hurst.
Thank you. Commissioner Morris.
Well, as Sue said when she looked at me, I've heard her speak before. Yes, many times. I was there when United Way launched United End Homelessness. Actually, was allowed to speak for a period of time, but that was, and if you want to see a video of it, go to YouTube's United End Homelessness. Look for Santa Bob. But I have heard Sue, and continuing from that point on, every time I get a chance, I go to any event Sue's putting on just to help support her. Thank you at all times, Sue.
Thank you so much. Appreciate it.
Thank you, Commissioner Morris. Okay, seeing no more comments. Thank you, Commissioner Parks, for the great presentation and for all of the insight you gave us to the work of the United Way and the United to End Homelessness. I'm a proud member of the Leadership Council. I too am freaking out about vouchers, so we have every right to do so. And we'll talk about that more later on in the meeting. But we'll now move on to our presentation items on the agenda. Madam Clerk, will you please read the next item?
Yes, item 4 is the federal legislative update presented by Corey Takinen, Vice President of Townsend Public Affairs, and we have no requests from the public to speak on this item.
Great, thank you. When we last received a federal legislative update at the April meeting of the commission, since then there have been additional action items and updates in the federal government that are impacting homelessness. Joining us today is Corey Takinen, see if I can get that right, Vice President and CEO of Townsend Public Affairs, who will be walking us through the latest executive orders and related legislative changes.
Thank you, Chair and Commissioners. I wish I could say this will be a happy presentation, but it probably will not be for most of you. I'm here to overview the most recent executive order coming out of the administration, an update on what's happening in Congress, and then looking ahead, which will touch on the vouchers that Sue just talked about. On July, oh, I missed a slide. This is missing a lot of slides in this presentation. I can talk through it, but there's, okay. I'll talk through this first slide. The first slide that should be on here is summarizing President Trump's executive order that was released on July 24th, titled Ending Crime and Disorder on America's Streets. The order marks a sharp break from the past 2 decades of federal consensus around a housing first model, and which prioritizes permanent housing and voluntary services. And instead, the order directs federal agencies to revise regulations, grant requirements, and guidance to end support for housing first policies that the administration views deprioritizes accountability and fails to promote treatment, recovery, and self-sufficiency. Instead, the order centers around behavioral health as the primary focus of homelessness policy, introducing mandates and enforcement mechanisms intended to reshape how assistance is delivered and who is eligible for that assistance. The EO directs 4 different federal agencies, HUD, HHS, Department of Justice, and DOT, to ensure that federal housing programs, where possible, are linked to substance abuse disorders or severe mental illnesses, active participation in treatment for substance abuse disorders and severe mental illnesses. It directs these agencies to prioritize jurisdictions for funding that enforce bans on urban camping, loitering, squatting, and open air drug use when they're awarding discretionary grants. The order restricts harm reduction efforts, and it directs DOJ to assess whether federally funded organizations that operate safe consumption sites, distribute drug paraphernalia, or allow on-site illegal drug use are violating federal law. and they are asking DOJ to initiate enforcement actions where applicable. It increases accountability according to the order and homelessness programs by linking them to public safety outcomes. Lastly, it mandates interagency data sharing with law enforcement. So HHS, HUD, and DOJ are instructed to develop policies to collect and share behavioral health and homelessness data and share that with law enforcement agencies. What that could mean for the county. In FY26, no appropriations have been put forth with any funding that would implement this executive order in any meaningful way. So this is all what we anticipate could happen based on the language of this executive order. For discretionary funding going forward, we will likely see these agencies take more of a focus on mental health, crisis intervention funding, funding support for drug courts and jail diversion programs like the Care Court program versus funding for housing first models. We also anticipate that there will be more questions asked in grant applications that are in line and consistent with the terms of the executive order and are likely directly linked to public safety outcomes. We also anticipate to see restrictions on certain programs, such as syringe programs, which means that ultimately the county may need to look at alternative funding sources if they wish to continue funding those programs. We anticipate that there will be new requirements from agencies such as treatment participation requirements, housing restrictions from certain populations, such as sex offenders will be restricted from entering into housing funded by federal dollars, and again, potential limits on safe consumption sites. We can also expect, as I mentioned, additional data collection and sharing that data with law enforcement agencies. So what are the next steps for the county? Thus far, the only responses that we have seen from the agency side is a statement from SAMHSA and a statement from the HUD secretary acknowledging the terms of the executive order. We have not seen any additional guidance at this time or any details on exactly what programs or how this will be implemented across these agencies. There are several provisions in the order that may face legal constraints. Because civil commitment procedures are governed by state law, the federal government cannot compel legislators to expand or amend them. Similarly, many consent decrees targeted by the executive order were entered into by local governments or courts, which limits DOJ's ability to reverse them. So we do anticipate litigation once agencies release guidance on how they intend to implement this order. The other thing I would mention as far as timing is the executive order does not have timing included in it. Many of President Trump's executive orders have a window of within 45 to around 60 days. This one does not contain that. So we really don't know at this point. It's been about 30 days since this has been announced. We don't know at this point what the timing of any sort of implementation looks like. So that is what's happening on the administration side. On the congressional side, I wanted to give some context as to where Congress is on this conversation. This is an interesting conversation that's happening. This bill, the Reviewing Opportunity and the American Dream Road to Housing Act, was introduced in mid-July. It's a bipartisan bill by Tim Scott, who's a Republican from South Carolina, and Elizabeth Warren, a Democrat from Massachusetts. And it's an amalgamation of several bills by the Senate Banking, Housing, and Urban Affairs Committee. It's the first bill in over a decade that has been introduced in the Senate that makes substantive changes to housing policy, not just funding programs. It's truly a bipartisan bill. It does not cover how to get people into housing. It does not look at programs. It is focused on building. It is focused on the infrastructure side of housing. So it is all focused on how to incentivize building. I'm not going to go through this line by line, but you can see NEPA reforms. You can see increasing CDBG incentives. There were some incentives that were eliminated under the One Big Beautiful Bill that this is proposing to kind of put back in and expand, related to increasing affordable housing incentives within opportunity zones, increasing the public welfare investment cap, allowing greater private investment to get into housing. So again, all focused on how we can build affordable housing units and streamline that process. It passed out of committee unanimously. It has a very real chance of making it off the Senate floor in the next few months, and then it will move over to the House. It has a tougher road ahead in the House, but it is truly being voted on unanimously as a bipartisan bill in the Senate. So it is very real for the House to take this up probably late this calendar year, early next calendar year. So looking ahead, what does this mean for the commission? Much of the executive order that I talked about is uncertain, from how DOJ is going to exercise its enforcement powers to how HUD and HHS are going to revise program rules and upcoming grant opportunities. But the key of this is that this is a fundamental shift in the federal government's view that the root causes of homelessness and the best ways to respond need to be focused around public safety and enforcement and behavioral health treatment, rather than approaches that lead with housing support. We also know that the emergency housing voucher program is set to run out as soon as September 2026. The realities of this Congress is that they will not lend themselves to a high likelihood of that program being reauthorized or additional funding being included in that program. So we're really realistically looking at a post 2026 election for any changes to be made to that emergency housing voucher program. But we wanted to bring this conversation to the commission to really have a discussion about looking ahead and seeing if we can come up with a narrow focus ask that the commission can support, that the county can consider on what change can we make? What advocacy can we do now? Knowing where the lens of the administration is, knowing where the focus of Congress is, knowing what the need is on the ground, how can we start to bring those pieces together? Public safety is a really big piece in all of this. They do have the ear of the administration right now. This is a 3-page executive order, and I think public safety's in it a dozen times. So how can we maybe look at our public safety partners, look at a lens where we can bring these pieces together and come up with a strategy to be able to continue the work that has been going on in Orange County. And with that, I'm happy to answer any questions.
So before I hand it back over to the chair, I first want to jump in and thank Corey for coming and providing such an important update here, and also sticking around for to be part of the discussion and ask questions. Understanding that there is further clarity needed around the executive order, it does provide a level of detail into the administration's plan to address homelessness that we have not previously had. It offers us enough detail to feel comfortable in understanding the direction in policy and messaging that the administration's taking towards homelessness, and provides us the details needed to fairly forecast potential impact here locally. The executive order has several components, as we heard from Corey, that really hit homelessness directly. But we also know that there are other areas around homelessness being impacted here. Sue mentioned, and so did Corey, the public housing authorities, specifically the challenges that they're facing around emergency housing vouchers. For example, OCHA, which is only one of the four housing authorities here in Orange County, although it's the biggest, is potentially seeing over 400 households losing rental assistance next fall. There are also major changes slated for the behavioral health world, benefits and Medi-Cal, the COC programming, and several other key sectors in our system of care. These impacts will potentially limit the people we can serve, as well as greatly impact how we could actually serve them. We've made great strides in the county over the last 10 years. We've learned a tremendous amount through clearing the riverbeds and the civic center encampments, as well as decreasing the number of people experiencing homelessness during COVID. We did all of this through creating a robust homeless response system and a system of care. There was a significant investment in ensuring that we had shelter and housing for many people, while also ensuring that we had a robust and dynamic set of services and benefits to assist people in addressing all the challenges in their life, not just homelessness. And because of that, we learned that housing coupled with robust services helps people get housed and stay housed. We learned these solutions through trial and error and have been fortunate enough to lean on those lessons learned as we continue to address homelessness here in the county. So this presentation by Corey today and my comments here are really set to provide and to set the table for what will hopefully be a robust discussion amongst the commissioners, understanding that each commissioner is a leader in their different sector of the homeless service response system. It will be helpful to hear about the different potential impacts you all are seeing from this executive order, but also from other activities happening at the federal level, as well as hear from you on how the lessons we've learned through the last decade to continue to shape the system of care and success should be used, and hopefully not take steps backwards. So with that, I really look forward to the discussion we're about to have and want to pass it back to the chair.
Thank you, Doug. Thank you, Doug. This is a perfect time for us to really open up the.
Oh, I'm
Yes,
sorry.
I'm sorry.
One more wrinkle. I think
good.
Julia Bidwell.
Sorry, Julia.
Would like to just give a further update.
Thank you.
Hi, good afternoon, Commission. Julia Bidwell, Director, OC Housing Community Development. If you say vouchers 3 times, you get me up at the podium. Like Beetlejuice, 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 voucher, voucher, voucher. So for the Orange County Housing Authority, the emergency housing voucher, the ending of the program and the funding, as Sue so eloquently pointed out, is a real critical upcoming issue. It's about a year and a half we have before the funding ends. As Doug is pointing out, we need all the partners in the room, a United Way, the nonprofits, those that have a voice in the community. Public safety is getting a lot of traction with the federal government. So anything that we can do to partner with those of you at the table that will help us dual track. One is to transition the clients, look for solutions and outcomes that are positive ones. And this is for over 400 individuals that may still have an emergency housing voucher in a year to a year and a half, given turnover. It's supposed to be a program that transitions itself out, just not that quickly. Just for perspective, the Orange County Housing Authority, out of 600 housing authorities receiving emergency housing vouchers, it's the 21st highest in the nation. I bet you can fill in Chicago, New York, Los Angeles, Atlanta, Philadelphia, and some of those others, but we are in company across the nation. So we feel it's very important to sound this alarm right now, gain partnerships around the table. We're working with TPA and coordinating to put it on their slide today, working with them and our National Association of Redevelopment Officials, which is the national advocacy group for housing authorities, and having a call with them next week. So we really putting a call out. I rarely do this, but I'm looking for anybody and everybody that will join us in helping these individuals transition positively and or finding creative solutions. Maybe their landlord incentives. I doubt that landlords want to see 400 individuals go off their rent rolls and potentially have eviction on their books. That is not an outcome I think that business wants either. So many partners. So thank you for letting me speak. And now I'm going to leave it to you. Thank you.
Thank you, Julia. I do have a quick question for you. Don't run away. As I understand it, most of these vouchers, the people that receive them are seniors. Is that correct?
So this is very specific. Unlike our regular housing choice vouchers, which a majority are seniors and disabled individuals, emergency housing vouchers were actually allocated and required that housing authorities had an MOU with the continuum of care. And so there were specific homelessness, domestic violence, human trafficking were the referrals from the continuum of care. I don't know the number of seniors in that population, but this was very specific. That's why working with the Commission to End Homelessness and the continuum of care because of who was referred into the program.
Okay.
It's important.
Thank you.
Yeah.
Appreciate your insight.
Yeah, absolutely.
Hey, commissioners,
Thank
I'd like
you.
to open up the floor for discussion and comment, please. Who wants to go first? Thank you, Commissioner Hawley.
So good afternoon, commissioners. I wanted to share a little bit about, from my perspective, concerns about the potential lack of federal and local funding for this area. But before I do that, I wanted to give a little bit of context of what I'm going to describe as the system of care that we've created in the North Spa. So excluding our colleagues from the city of Anaheim, the North Spa consists of 12 cities with 122 square miles of geography, residential population of 720,000 people, and a point in time count from 2024 of 1,039 individuals. Those numbers are larger, that's a larger service area than any one of the big three cities in Orange County, Anaheim, Irvine, or Santa Ana. In 2024-2025, we served 744 unduplicated clients in our 2 navigation centers, which have a total capacity of 250 beds. Most of you know, because I've spoken about this before, that we onboarded and started the Hope Center in 2023, which is an operations center that houses our respective homeless liaison officers and homeless outreach coordinators for 8 of those 12 onboarded cities. We've created our own technology, a shelter bed reservation system and dispatch center called Outreach Grid. And we've worked from the beginning with allied agency partners like, and I always mess up the pronunciation of this acronym, VOA-LA. I have to say that very deliberately, and others. And I'm very pleased to see future expansions. For example, beginning in early September, we're going to be embedding PERT clinicians at the Hope Center to serve mental health needs in our service area, and also a substance abuse specialist through the opioid settlement funds that are coming to our respective cities. And we have street medicine coming soon. That's something that's in the works. As I mentioned, the 2 navigation centers, we alone in the north have 250 beds compared to the 625 beds that the county operates at Yale and Bridges. You know, our federal funding, that's what stood up the Hope Center for us. We received 2 separate rounds of federal funding, $5 million apiece through Senator Feinstein's office and Senator Padilla's office. Most recently, through this current budget cycle, we requested another $5 million, which would allow us to continue operations at the Hope Center through the year 2030, which would align with our current funding for our navigation centers. However, through this budget process, we've already gotten word back that our $5 million request has been greatly reduced. Now we're only looking at a potential of just over $1 million, which is obviously very concerning. So that's going to limit our ability to do that. On the navigation center side, costs us about $4 million a year to operate those 2 navigation centers. A lot of that funding coming from SB2, which is about 2 years behind and causing a significant cash flow problem for cities that fund those operation or navigation centers. And we know that our future SB2 money is further restricted because at least 10% of that has to be used for home ownership activity. Yet, despite these kind of large numbers, talking about this at a local level, throughout the past several years, our North Spa has received 0 in HAP funding, which is concerning because that money could be used for things like operating our navigation centers. And we know in the current budget crisis, many of our cities are facing difficult decisions, and the thread could potentially be pulled, and this could start to unravel where we may not have 12 cities that are funding these 2 navigation centers, and they're in danger of operations and potentially closing down in the future. So for me as a takeaway, like I completely agree. The need for federal funding, local funding is very important. I think permanent supportive housing, very low income housing, and low income housing are critical. But the gateway to all this is the navigation centers. We have to have funds to keep the navigation centers. And we're definitely in support of constant advocacy and ongoing lobbying for additional federal and local fundings for these issues. Thank you, Commissioner.
Thank you, Commissioner Hawley. I saw you thinking about it, Sue. Commissioner Parks.
Yeah, the one thing that was been going through my mind is, are there, and maybe this is one of them, the navigation centers, certainly I think strongly about vouchers, Julia. Three things, 1, 2, 3, no more than 3, that we, in all of our individual advocacy, we're all sharing the same message, that we're all aligned as a community. And I think that would be really important. So if, you know, we're talking the same talk, and certainly we can put together the joint letters and all of that, but I think in all of our individual meetings with everybody, somehow we need to, I mean, this has been working. We've been housing people. We've had progress and things that's working. So we need to get that attention. So I guess building one strong case, 2 or 3 strong asks that we could all be doing in whatever forums would be my suggestion.
Thank you, Commissioner Parks. I agree with you. We need to have a shared voice and be united in that, and how we're talking about this out in the community. I mean, for seeing the housing reform bill trying to move forward. Of course, as a developer of housing, we have a lot of hurdles that we have to jump over, and that's really important. But at the same time, my opinion, we cannot just pull vouchers from people and leave them on the streets while we're busy trying to build housing. This is an interesting perspective that I have. Homelessness is not a crime, yet public safety is being targeted and coupled along with homelessness. And I'm having a hard time. I understand that there's public safety issues with people living out on the streets and doing drugs out in public and crime that incurs because they're hungry or need to go to the restroom. But it's hard for me to think where are you going to put everyone? So I can get fired up on this issue, and I probably should keep it a little bit here. But anyway, I'd love to hear from my other fellow commissioners. Yes, Commissioner Bruno Nelson.
So Medi-Cal has seen tremendous expansions over the last 3 years, and a lot of that expansion has had to do with the fact that housing is health, and we know that. So there's been a lot of services that have been added to Medi-Cal through CalAIM to address just that, to ensure that our folks, our members, are not only finding housing and getting housed if they're experiencing homelessness, but that they can remain housed. And those services allow them to do both of those. I'll echo what I'm sure many of you have heard Michael say time and time again over these last months, is that as far as eligibility, nothing has changed for Medi-Cal right now. The folks that are eligible yesterday are eligible today. But that doesn't mean that things aren't going to change in the future, and we know that they are. And it also doesn't mean that folks aren't afraid to access the care that they're eligible for today, and we know that they are. We know that our clinics, our community clinics, are seeing vast reductions in the folks that are entering their doors because folks are sincerely afraid to go. We know that in the future that folks that are eligible for Medi-Cal are going to have to redetermine twice a year versus once a year. We know that folks that are eligible for Medi-Cal are going to have be subdued to work requirements that they're not subject to today, and the list goes on. That being said, there's going to be fewer folks that are going to be enrolled in Medi-Cal, and when that happens, then they're going to not have access to those very services that have allowed them to secure and keep their housing today. I think we're doing ourselves a disservice if we don't recognize that this isn't an issue that is just having an impact today, that it's going to trickle and keep going next year and the year after that and the year after that. And it's unfortunate to see all the good work that we've done at some point being undone. But when we think about the solutions and what we need to do, I think we need to look at a long-range strategy and recognize that addressing it in the next 3 to 6 months isn't going to be long enough.
Thank you, Commissioner Bruno Nelson.
Thank you. So although Supervisor Sarmiento isn't here, although Supervisor Sarmiento isn't able to be here, he's already been briefed, and I think all of you know how he feels about this topic. I think since January, we've seen a lot of changes that have had direct negative impact county as a whole, but specifically, I know within the 2nd District, which jurisdiction or so. I want to ask Corey, can you help? Oh, okay. Can you do you have any suggestions on some things that we can advocate for? Like you were saying, like 2 or 3 things that we can get behind and push for that could actually do something or move or be effective?
What we were discussing with staff, we had a couple calls about this in the last few weeks, and what we were discussing with staff was how can we almost rebrand the housing choice voucher program in the terms that the administration is using. I think the county has done a very good job of having accountability metrics and making sure that people are moving through the system. And how can we maybe add in some of those metrics and requirements and accountability measures that we are already doing in Orange County that maybe others in the nation aren't, to create a higher level of program that sort of weaves in the themes that the administration is looking at, weaves in the partnerships with public safety, and ensuring that they're a key component of this, but also kind of keeps that trueness of the program. An interesting piece of Secretary Turner came out with a HUD response to this, and it was very much, we support the administration. We're going to do, what the president's looking for. But he also said that he kind of doubled down on the VASH program and said that we are continuing to provide these for veterans. And in fact, HUD has allocated an additional $2.2 million for tribal VASH vouchers. So there are pieces within the administration where they're still looking at vouchers. I think we need to look at how we can kind of elevate it, rebrand it, and come up with a maybe rebranded program that incorporates some of these measures.
Thank you. We have actually been talking in our organization of how do we actually remove the word homeless from what we talk about, which is terrible to say, but something that I think we all need to think about of how do we change that perception that people have, especially when it comes to, this is all a public safety issue. How do we help people understand that, no, we actually need to be able to house our neighbors? So I appreciate that you're looking at that as well as how do we rebrand everything that we do to make sure that we don't lose all the momentum that we've had over the last couple of decades, actually. So do any of the other commissioners want to share? Yes, Commissioner Fauble.
I just wanted to address one of the items that is in the report, potential implications for the county related to the executive order. Specifically calls out address the mental health treatment bed shortages. And my preface to the comments that I'll make is that we as a community did not specifically design our intentions, have intentions, or specifically design around what this executive order entails. However, what we did do as a community is we addressed the issues around mental health treatment bed shortages very specifically. Many of you will recall in discussions that happened by those of us who were here at the commission back 5-6 years ago around the creation of and the development of Be Well Orange County, which was a public-private partnership of bringing together and doing just this, which was to address the mental health shortage. I want to remind the commission that of the specific things that have been done in regards to that public-private partnership. In 2022, we doubled the number of crisis stabilization beds through the opening of a unit in the city of Orange. And doubled the number of CSU beds, and then did something, a first for Orange County, which was to open up the first 8-bed adolescent crisis stabilization unit for mental health. Did not exist before then. We also opened the first sobering center in Orange County, 12 beds for specific treatment of substance abuse. That was a major event. It's a very significant one. And kudos to the city of Orange to allow a mental health facility to open up in their city. That was a major advance, for sure. That advancement continues, and again, want to make sure that we all understand this was not designed specifically to address what we thought would be an executive order or federal funding changes, but rather merely to do the right thing. It was merely to do the right thing. The Irvine campus of Be Well Orange County will open in another month or two. It doubles again the number of crisis stabilization unit beds, including adolescent beds. Also doubles the number of sobering unit beds in the county, and does two other very unique things. I forgot to mention that we created residential beds for mental health at the Orange campus. We are also adding residential beds at the Irvine campus, but two very unique things are happening in the Irvine campus. The campus, by the way, is right next to the Great Park, so if anyone is interested, the campus that is developed again in public-private partnership, primarily through the County of Orange, as well as from the hospitals, from Cal Optima, and from others, has added adolescent residential care, mental and behavioral health residential care for adolescents, which does not exist in Orange County today, and then a perinatal unit. New mothers with mental health disorders will have a safe place, a residential unit run in a very, very, let's call it a community-based way, as opposed to some sort of business developmental way, a community-based way for new mothers and new families with mental health disorders within their families. Very unique, first time in our community. We have done some addressing of the mental health bed shortage, and we've done that in a very intentional and developmental way. Again, not specific to the executive order, but only specific because, and only done because it's the right thing to do. Wanted to make those comments.
Commissioner Fauble. Yes, Doug.
Yeah, I guess if I wanted to sum up what I've heard, both as the staff here and what I think might be helpful as well is to add a little bit more context of what we're doing here at the county. And that might help us provide a little bit of direction for where you all as a commission might want to go. So really, I'll speak to two things. I'll speak to the executive order and the emergency housing vouchers. Both of them, what we're doing as a team, as a staff, obviously led by our CEO team, is trying to do what we should be doing, which is looking at each move or each action to see where we can use that as an opportunity. So for the executive order, although there are many things in the executive order that I think a lot of us are waiting to see impact on, messaging might not align with our pillars. There are specific things that the executive order is looking for communities to do. And as you look at them specifically, without further definition, of course, we're doing most of them, like Dr. Afable said, and how can we as a community leverage that? And then on the flip side, where there is areas where we have learned through our lessons and our experience and our expertise, where we need to move more in an advocacy way, we're working with our team and luckily TPA on those, and we'll share what those activities look like. Very similarly with EHVs, and we're really lucky to have OCCR leading our housing authority, not just in this exercise, but in everything they do, because of their ability to sort of raise the flag on potential impact here that we've heard. EHVs feel like at least to me, the first really direct local impact that we can see. And thinking about 400 households potentially entering back into our system, or at very best, us looking at different resources, that would be, like Sue mentioned, it would be taking away resources from the people that are currently experiencing homelessness. Nonetheless, we have a multi-departmental effort going on to look at each household to see if there's other programs that can step in and provide the support that they need. I think we understand that there is a great likelihood that that solution will not solve the problem for everyone. And yet again, we are looking at the advocacy part here as well. So hearing what I've heard here today, and it's really helpful to hear this discussion, we know that there are many different sectors here impacted. Obviously the two we mentioned, The COC has specific language that's being passed through in terms of their standard agreements that's limiting the folks that can be served. We know that some of the immigration enforcement that's going on is keeping, I mean, we hear it from some of our folks, is keeping some folks from accepting services or coming out for services. How do we work with them to make sure that they continue to seek services? Also, sort of a little something that sort of hides in the background a little bit, I think, is also USICH. USICH is, they've come here and spoken to this commission a couple of years ago, but they are the federal department that has always been charged with coordinating amongst, I think, 27 federal agencies to help organize the federal approach. And then where they've been so valuable is by providing guidance to legislation and executive orders like this on how communities should, how they should move forward. And they have, their staff has been turned from about a couple of dozen to one, and that plays a role. So all of this being said, as a staff, I think what I hear is that our office will work with the commissioners over the next 2 months. This is our suggestion, to really understand impact at every, in all of the sectors. Then help align and bring that back to the commission to sort of understand the impact, have the commission provide a little bit of guidance on where our priorities are, where our lane is. And I'd imagine that's all going to be rooted in sort of these learned lessons that we've discussed today that, just as a reminder, have been codified in our pillars and that we have here in front of us, that this commission has created to really outline and define specifically what we see as best practices and guiding principles. So we look forward to moving in that direction, if that's where the commission feels comfortable. I'm also interested to hear any other exercise in which the staff can be helpful. I know that United to End Homelessness is doing some really great advocacy work around this area. And I heard this group speaking about aligning messages. And I know that in our bylaws, as we spent so much time over the last couple of months reshaping our bylaws, it speaks to the importance of this group aligning with local leadership and being partners and ambassadors to best practice. So, yeah.
One quick comment. It would be helpful to know how everybody's advocating so that we can support each other. So if somebody's working on something, if you let us know, then we can perhaps work together.
And I'll put that on the list because that is really important, and we'll share that throughout throughout the commissioners and the community as well between now. So I say our next meeting, which I know is 2 months from now, but communication will go out from our office in between those meetings to keep folks up to date.
Yes, Commissioner Hurst.
Thank you for those comments. I wanted to stand in solidarity with our partners that have spoken. The voucher issue, thank you for that. As a large shelter operator, we've seen the high impact of that directly in the homeless services space. And with the North Spa, we are the operators of one of the navigation centers. Thank you for that. And our great friends at Cal Optima Cal AIM. We've seen the high impact, specifically I have on the streets of Anaheim, on a lot of and as a participant in the Cal AIM programs. These are robust forces at work to lift up our community. And I would say, as a word of encouragement to this group, I personally don't believe homelessness belongs to any political party. And when I say that, what I mean to say is Salvation Army is a large national organization that is representative of America. And in that respect, we have a lot of team members that might be regarded as liberal, social work, graduates, et cetera. We have a lot of partners that are conservative in nature and write checks to help our frontline workers. I have personally, over years of experience, specifically in the community engagement and fundraising space around the homeless issue, you have to learn to speak the language of who you're talking to, because there is a lot of shared value in this space. I think that's what's often overlooked in this discussion. There is a great humanitarian heart in this space, shared across the community, that if we can touch that, and I mentioned the other day, I wanted to specifically thank Cal Optima's CEO Michael and his comments about framing what some of the impact of this does on a humanitarian level. And I thought it just struck the perfect chord of reaching the heart of the community. I would just encourage the commission, as we're thinking about this, there is a way to dialogue with this new administration that may get some of this stuff done. And that way is adopting some of the language about how you help people. There is a difference. There is a difference in how we speak. And I think that's part of the problem. We need to talk in more empowerment terms. We need to talk in more of, let's help them rise up and live victorious, autonomous lives. That's the language this present group seems to want to lean into. I know that's layered with a lot of philosophy. That's not my point here, but my point is I know so many of the community leaders in this space. There are a lot of people that share those same values from across the community spectrum. That is the space I believe we're going to see the most positive traction, to take the issues we're concerned about, whether it's vouchers, whether it's about funding for navigation centers, whether it's about the continuations of CalAIM, CalOptima initiatives as examples. Take those, get before these key decision makers and help them see it as couched in their value language. Because I would just encourage the group to say, there's a possibility to do that. That doesn't mean we'll get the outcome we all want, but it does mean there is a space here to dialogue about this in a way that is not happening. And I can tell you, the leading national voices in the homeless space are not helping us right now. I will just say that, because of the tact and language they're using is an affront to some of the key decision makers in Washington right now. That is what it is. I would just encourage us to take a fresh look at how we go about that. Thank you.
Thank you, Commissioner.
Ben, you're speaking my language. When the executive order first came out, there was I saw the panic, right? And for me, I read the executive order and all I saw was opportunity. And it's exactly what you said, Ben. And what I told my team is, we don't look at who's in the White House. That doesn't matter. It doesn't matter which party, because it's about the people and how we can leverage and use this as an opportunity, because we have OC Cares. We have this commission. We have to get beyond and past that and look at what the right thing to do is. And so, right, under Doug's leadership, we've had, several meetings internally. Corey was here today, and I think she already had to leave, but, we've been already working with Townsend and talking about how we are going to message this. And I'm like, don't overcomplicate it. Don't overthink it. It's just a strategy, right? And promote what we are already doing here in Orange County. And really, it's just, right? It's a tough love approach is the way I look at it. It's a hand up rather than a hand out. Keep it in simple terms. And it's really what we're already doing here. One of the things I think that bothers me on an ongoing basis, and I'm hoping, right, this will be an opportunity, is, and in looking at like the emergency housing vouchers, we have base and core funding, right? That needs to be reset, not supplemented by, oh, this happens and we get a little bit more money here. Oh, this happens and we get a little bit more money here. What I've messaged to my team is if the federal government is going to issue their executive order, then hold them accountable, right? We need more federal funding here in Orange County for our vouchers. You want people off the street? This is what we need. We identify what we need, what our ask is. We already know what our gaps are. Communicate that. And they either give it to us or they don't, but if they don't, then hold them accountable, right? It's like, we're here to partner with you. And I agree with you, but we shouldn't be speaking out or the messaging that is negative against them, all right? They're just gonna be like, yeah, no Orange County, right? That's not the way to strategically go about doing it. It doesn't matter what party you're in. So I hope that we can all use this as an opportunity to truly work together. We're already working on our messaging and we hope to partner with, right, all of the entities in that. I know we had talked about, you know, is it a letter signed by all of the parties, everybody? So we'll figure that out what the best strategy is, but just appreciate it if we all can work together on it rather than against each other. Cause I know it's like, right, everybody's always competing for the resources, but really it's one Orange County, it's one team. And so hopefully that we are just using this as an opportunity to just do more of the work that we're doing. So thank you, Chair.
Thank you. I love where this discussion went. I would recommend that we really work towards exactly what everyone's saying. I can remember talking to young grant writers, trying to teach them when a funder has certain focus areas, use their language, use their words, and help them understand and help change their perspective with what we need. If we're going to look at what all of the federal guidance is coming down that we might be losing, I would suggest that we put that in order of importance and try to say what's most important. Is it navigation funding? Is it vouchers? Is it this? Is it that? And then try to come together and figure out what can we tackle first? How can we maybe get things funded in a different way? Maybe this can't be, but we need this. So I'm excited to work in this space and to come together as a team, an entire community to make some changes. So thank you everyone for that great discussion. And I was going to thank Townsend, but I'm going to thank them. I know Corey already had to leave, but we'll move on to our next presentation. Madam Clerk, will you please read the next item?
Yes, item 5 is a presentation titled Falling Through the Safety Net, Understanding Individuals' Journey and Contributing Factors to Homelessness, presented by Doug Beck, Director of Care Coordination. And we have no request from the public to speak on this item.
That's great. So just to preempt, because I have this little thing highlighted, I'm supposed to read first and then introduce you. So in January 2025, the commission had a joint special meeting with the Orange County Continuum of Care Board to discuss the proposed questions for the 2025 survey. This provided an opportunity for 2 key groups involved in the homeless policy to collaborate and provide feedback to shape the survey. Doug, through his Office of Care Coordination, updates a portion of our agenda and has provided updates on progress for this item throughout the last several meetings to all of us. And he is now ready to give the results of the 2025 survey, but I know he's going to sum that up because we had a really good, robust discussion beforehand. So Doug, I'll turn it over to you.
Yeah, so I'll be as quick as I can. And the good part about being quick is that we have and the commissioners, I believe you have received notice, a joint meeting on September 10th with the COC, just like we had prior to this survey coming out, to further go into the survey here and then really talk about and hear from you all what you see as findings and next steps and recommendations. So I'm going to be really quick. By 2:50, I'll be done maximum. So I'm going to skip through, for obvious reasons, some slides here. Just a real quick reminder, we sought, like we did in 2023 with that survey, to survey 20%, a representative sample size of 20% of the unsheltered population. We felt like that gave us a good representative representation of the entire unsheltered community here in Orange County. We created a survey that was essentially 50 to 70 questions that we would ask individuals out in the community that really spoke about their journey into homelessness. And we've titled this Falling Through the Safety Net. And you'll see why as we very expeditiously go through this report. and then hopefully as we go deeper on September 10th. We deployed in March 2025 with our partner CityNet out and canvassed all 34 cities in the unincorporated area to collect the 840 surveys that we were seeking to collect, and we did that. The surveys took about 18 minutes. Real quickly, limitations. This is a self-report survey, and that it's a reminder that we are only surveying those that fell through our safety net. There's a really important story to be told by those that sought help, got help, and prevented their homelessness. But we're not telling that side of the story here. Quickly, what we saw when we surveyed folks was what we regularly see, which is that people are experiencing many different lengths of homelessness. So a little over 7% of folks reported being homeless for only 1 week when they were surveyed, and 4% of folks reported being homeless for over 20 years. And then obviously, you know, a disparate distribution in terms of time intervals evenly throughout. We saw that 3/4 of the people are living outdoors, which is similar, as you can see here, comparing the 2023 survey and the 2025 survey on this data point. 20% of our folks are living in vehicles. This is going to be a real reminder of how much of a real challenge outreach is in our community. We know people in vehicles, A, just because they're in vehicles, it's harder to find them, and B, because those vehicles move, there's parking restrictions, things to that nature. Staying in contact with people is really difficult. When we asked these folks, what was their housing, where did they live prior to becoming homeless? We got two really big answers here. One, which is with a friend or a family member, and the other was stated that they were renting. And you can see it's a fairly even split there. We asked those folks, okay, were you on the lease? And essentially what we saw was over 60% of the folks said no, I was not on the lease, which is sort of speaks to the sort of permanency that or ownership that a person has of that space. When we looked at income, we saw that people were making, and I think it's a little over 70% of the respondents reported making under $3,000 a month prior to becoming homeless. The area, as you can see here, the AMI for just a single individual in Orange County is $8,000 a month almost. And as you would expect, anyone experiencing homelessness, but almost 90% of the, well over 90% of the individuals that we surveyed were not coming close to making the area median income. So if you think about how much money you make, you then think about how much were they contributing towards their housing. And as you could see here on the side, the deck on the right, it's almost 90% of folks were contributing less than $2,000 a month to rent or a mortgage, arguably stating that these folks weren't necessarily paying their fair share of the mortgage to stay. And as you can see, the bar all the way on the right, for those of you that with poor vision, shows that over 1/4 of the folks weren't contributing at all towards their housing costs. We wanted to take a look at whether or not people were connected to the justice system, or there was some indicators here. I think it's important as you look that this group experienced incarceration prior to becoming homeless 9 times greater than the national average. We see similar stuff in probation, being in subsidized housing before homelessness, foster care, childhood poverty. So some thoughts about where we might be able to catch people. We asked about mental illness. I'll sort of skip over that in the spirit of time. When asking folks, what were factors that played into you falling into homelessness? As you'd imagine, the biggest one was finances. So people, but they also mentioned relationships, health and safety, systemic. So many things contributed to an individual's experience into homelessness, but the one that they all agreed upon or most agreed upon was finances. I once heard someone say, and I repeat it often, homelessness is often a mental illness problem. It's often, a substance use issue. It is always a housing issue. So finances line up, obviously with that housing piece. When we asked them what was the most important or most impactful factor, they stated finances again, with relationships and falling out relationships right behind it. What I think is really interesting here is that we saw that 12%, only 12% of respondents stated that they sought help prior to becoming homeless. I'll dive deeper into this in September. There's a lot of reasons around this. We asked folks what would help them avoid homelessness. A lot of them talked about the need for some type of either affordable housing or rental assistance, or in something to help them pay for housing, and some type of housing that was affordable. One of the slides I want to highlight before I pass it back to the chair is income. This was really interesting. Now, the yellow on the right is, for lack of a better word, very hard to see in this slide, as I'm noticing. But what the purpose here is over 60% of the respondents said that they were earning an income prior to becoming homeless. When we asked them about their income now, when they were experiencing homelessness, that number shrunk to 7% of folks stated they had an earned income. And 23% said they had no income prior to homelessness. That number grew to 55% when they started experiencing homelessness. So it speaks to people were originally contributing, earning an income. As they move into homelessness, as we know, the cards just continually become stacked against them. The community, the need for assistance from the community grows. It just speaks to the importance of us as a community and our ability to help people avoid homelessness altogether, and the impact. We have a little bit of data here around mental illness pre and post, as you can imagine what that would look like. My last slide here before I go to our findings is that when we ask people about their safety nets currently, only 17.5% of the group said that they had a friend or a family they could reach out to and support them. So yet again, that speaks to folks getting isolated, now the importance of whether it's local government or the nonprofit community coming in and really supporting an individual. The key findings here that we saw, we'll keep it really high level. We're going to discuss some more on September 10th. And these are going to sound really bland and basic, but they're very true. The factors for people's journey into homelessness varied. Everybody's path was different. What we did see is that prior to becoming homeless, people were already vulnerable, and there was different vulnerabilities that were that they identified experiencing. But what we saw was that everybody had something that sort of indicated where challenges were hitting them in their life. Third, the safety net resources and programs were not accessed prior to their homelessness like that. It was really remarkable to see that only 12% reached out. And then financial factors, yet again, play a really important role here. That's not to say, and I think it lends itself to our last discussion. If homelessness, like any social issue, had one solution, we would have already solved it. We've learned that here. Finances and affordable housing is so key, but in order for people to be able to afford housing, but those support services to help people stabilize in that housing is equally as important. And then our survey is consistent with the previous statewide and national studies. And that gets me 1 minute over.
Thank you, Doug. You did great. I would like to open it up for any discussion or questions, my fellow commissioners. I, for one, found the results very interesting. I think we can dispel some myths and maybe try to change some perspectives out there by really having all of this data and that shared messaging that we've been discussing together today. So I really appreciate the time that you put into finding these results, and I look forward to the September 10th meeting so we can dive deeper into it.
Yeah, I didn't do the survey justice by any means, a stretch of the imagination here. You guys showed up in full force in our joint meeting last time. It was so incredibly helpful. Please, if you could make it this time, if you have to send a proxy, we want people in the room, and we want to hear everybody's voices. And I think people will be really interested in diving into some of those data points deeper.
Thank you. Okay, let's move into action items. Nobody leave yet. We need you to stay. Madam Clerk, will you please read the next item for us?
Yes, item 6 is to approve recommendations for appointment to the following candidates to serve on the Commission to Address Homelessness and forward to the Board of Supervisors for final approval, including Susan Parks, President and Chief Executive Officer of Orange County United Way as the business representative, Benjamin Vasquez, Mayor Pro Tem of the City of Santa Ana as the Central Service Planning Area Representative, Deborah Rose, City Manager for the City of Lake Forest, is the South Service Planning Area Representative. Ivan Pitts, Senior Pastor at the Second Baptist Church as the Faith-Based Community Representative. And Benjamin Hurst, Director of the Salvation Army, Orange County, as the Philanthropic Leader. And we have no requests from the public to speak on this item.
Thank you, Madam Clerk. Before Doug walks us through the candidate recommendations made by the Membership Ad Hoc Committee, I would like to take a moment to thank my fellow commissioners who did the work on the Membership Ad Hoc for their thoughtful approach in reviewing the applications and the candidates. I know it takes a lot out of our busy day jobs to also sit on these ad hoc committees, but they're very important to be able to really dive deep into some of the things that we need to recommend as a commission. Doug, I'll just let you walk us through it. There you go.
Perfect.
You have 7 minutes.
So we've gone through this in this commission. Almost all of you have been through a membership process before. So as a reminder, we have a really active membership ad hoc this year. Really appreciate the work. The first exercise they did was update the application to ask a little bit more information. And we saw that as really helpful as the group evaluated the applications we got for the 6 seats that were advertised for the month of July, for almost the entire month of July. We received about 24 candidates for these 6 seats. The membership ad hoc went through them thoroughly, and as you can see here today, is recommending appointments for 5 of those seats. The 6th one is the lived experienced representative. That's a new seat here. We had a lot of really great candidates. We wanted, the membership ad hoc wants to go one further step to continue to explore the applications that came through. And we anticipate that the recommendation will come in October along with the next 5 seats that are up. So I'll quickly speak about, so we have 5 recommendations today in front of the commission. We have another 5 seats that we will open recruitment for in the next week or so. That's the hospital representative, the behavioral health representative, both continuum of care representatives, and the Orange County Sheriff Corner Department representative. And we really hope to get as many applications, especially qualified applications, in that round as we did in this round. We will be bringing recommendations for all 5 of those seats and the lived experience representative seat to the October meeting. Back to the folks that are being recommended today. If approved by this commission today, our office will these names in front of the Board of Supervisors for final approval sometime most likely later in September or early October. That will allow us to have those members be seated for our next meeting in October. Thank you on the recommendations and the ad hoc, and I'll pass it back to you, Chair.
Thank you, Doug. Do I have a motion on the floor to approve these recommended? Thank you, Commissioner Morris. A second?
Second.
Just kind of both of you at the same time. We'll let the clerk decide. Great, thank you, and welcome for the continued service of our commissioners that are here in the room. We look forward to having you part of our team. Thank you. Okay, we will now move. Vote.
I was just gonna say,
You guys gotta catch me. Okay, we have a
Take the vote.
motion and a second. All in favor?
Aye.
Any opposed? Any abstentions? Passes. There we go. Okay, that's not on my list here. I'm trying to read the script. Now we will move to the last action item. Madam Clerk, can you please read that item for us?
Yes, item 7 is to approve the Commission to Address Homelessness minutes from the June 18th, 2025 regular meeting, and we have no request from the public to speak on this item.
That's great. Is there any comments or discussion with my fellow commissioners? If not, I'm looking for a motion of approval. Thank you, Commissioner Fauble. Second, Commissioner Parks. All in favor?
Aye.
Any opposed? Any abstentions? Passes. Okay, so this concludes the meeting of the Commission to Address Homelessness. We are now adjourned. As a reminder, please note that the joint special meeting of the Orange County Continuum of Care Board and the Commission will be held on September 10th at 1 p.m. And our next regularly scheduled meeting will be held on Wednesday, October 15th at 1 p.m. Thank you all.
Nicely done, Sharon.
Except I couldn't remember your last name to address you, and I was like, oh, heck. Proxy. Totally, right?